The camp came about out of desperation, because in April 2013 we had 50,000 people marched on the streets in order to save a fully functioning hospital. That was completely ignored. In September of 2013 we had another march with 20,000 people, which was exclusively for a children's march to save maternity. That was ignored. The TSA and the local CCG pushed on with the plans for Stafford regardless.
A lot, I think, are devastated. A lot believed what they read, because if it's on the news and it's in the newspapers, it's therefore true. And I think they were frightened, and they were also frightened of saying, well, look, you know, my mum or dad was in there and they had excellent care. They were frightened to say that because they were shouted down. They were told they were liars.
Vases come in all shapes, in stone and clay and glass. But if anyone else repeats the myth that patients at Stafford Hospital drank out of them, I'll stick one up their arse.
And then, of course, what happens in the media is they realise, well, actually they've hyped it up. So then it becomes maybe 1,000 deaths, then maybe 600, and then a month later it might be 300 deaths. And actually the Francis report said that maybe there was one death.
But actually we didn't have hundreds of inquests, we didn't have hundreds of funerals. Stafford isn't a very big place. Everybody knows somebody. Everybody would have been to these mass funerals at some point, and that just didn't happen.
And last year, Stafford Hospital was rated, I think it was 96% across the KPIs for the hospitals, key performance indicators. Well, 96% was basically in the top 20 in the country for its services. UH&S was ranked somewhere around about 56%, I think it was, off the top of my head, which is barely average.
The Trust Special Administrators had a consultation meeting. 2,000 people turned up for that. A good 1,000 of those people couldn't get into the main hall. They were excluded.
The people in the town, not just the town, but the surrounding areas, Rugeley, Cannock, have been absolutely brilliant. You know, they've donated food, they've donated tents, they've donated blankets, firewood, you name it, they've done it.
Well, we've been fighting long and hard for 3 years now to see what we can save at Stafford. But now that the fight needs to go out nationally.
I think what you should do if you've got a problem with your local hospital is, firstly, you should do everything you can to support any other group, whether that's a petition online and then I think maybe you've got to think about coordinating, getting in touch with other groups on social media, etc. Coordinating, and whenever that other group has some sort of event, go there and try and support it, and let's just at least get the message out.
It's difficult fighting something totally on your own. You need other areas because it's happening all over the country. As we've learned, because we just have not had the media attention, the national media attention, that anybody outside of Stafford doesn't know what's going on here, and it's vice versa. We don't know what's going on in other areas, and a lot of the general public just don't know what's going on elsewhere. It's not just happening here, it's happening all over the country, and we need to join as a force, really.
We're pensioners, Pussy Riot, and we're prepared to go to jail. We'll make mincemeat of Jeremy Hunt, the BBC and the Daily Mail. Comparing ourselves to Russia, we thought we'd never see the day. Over our dead body will they take our NHS away. Power to all pussies, whether ginger, black or grey.
It was an example of this isn't just a threat to the NHS, it's a threat to democracy itself. you know, the CEO of UHNS didn't want to hear our voices, and he wanted to quell our voices, and I think that's quite a worrying thing. This is as worrying as the attack on the NHS itself. And that's what we've experienced through this. Our democratic voice has been completely and utterly disrespected.